That you're on mute. Hi, everyone. My name is Chris Permasio, and I am the proud executive director of the International Surf Therapy Organization, or we refer to it as ISTO. So, quick housekeeping. We'll be recording this, and if you don't love your face on the record, please turn your camera off. But we will also be sending the recording out about an hour after we sign off. And we will have lots of time at the end for questions. For those who have to sign off right at the hour, Jamie has already said he'll stay on if there's more questions. So thank you, Jamie, for that. And if you don't love asking questions over, with all these people, please feel free at any time when it comes up, put it in the chat and I'll be monitoring it and making sure Jamie gets to it before we miss out. So let's get this show on the road. Please join me in welcoming Dr. Jamie Marshall. And I have to say, it's a genuine pleasure to introduce him. In addition to his academic achievements, which there are many, I consider him a very dear friend of mine. He's also the chairman of the ISTO board. Jamie is going to share a lot with you today, so I'm not going to rattle off his CV. But what I love about his story is that his research, it didn't come first. And Jamie, don't hate me, but his research didn't come first. The work did. He began his career by founding the Wave Project in Scotland. And it was really that hands-on in the field experience that led Jamie to ask kind of the question that few of us had thought of, which was, why does this actually work? So that question then turned into the world's first PhD explicitly exploring the mechanisms underlying surf therapy, which he completed in September 2022. Do I have that right, Jamie? I hope I do. Since then, Jamie has continued to build bridges between research and real world impact. And in case it wasn't obvious, Jamie practices what he researches when he's not working. You'll find him surfing, free diving, spearfishing on the beautiful Scotland coastlines. Jamie, you bring a rare combination to this conversation. Someone who's founded a program, you've lived the experience, and you've lived the practice. You've done rigorous science and never lost the passion that started it all. So thanks everybody for being here. And to my sea brother, colleague, friend, Dr. Jamie Marshall, take it away.
Thank you, Chris, for that very kind introduction. I think you've spoiled the first half of my presentation there with the story, but it's all good. It's all good. Just one little piece of housekeeping from myself, and me and Chris have talked this through. For those of you who aren't based in the UK, I am, along with my professional roles, I'm a volunteer on our local lifeboat. So that's essentially a rescue boat that goes out to sea if someone needs a hand. And I've got a little pager here. And if that goes off, I'm very sorry. I will have to jump off the call and head out into the Atlantic. Extremely unlikely that's going to happen. But me and Chris have already put a plan in place that we will rearrange it, or I will record what I didn't get round to and send it out if that extremely unlikely eventuality is to happen. But I thought I would just share that with you. Now for the fun bit where the technology doesn't work. Let's see. Chris, can you nod if you can see that? Perfect. There we go. It worked first time. So yeah, welcome everyone to this webinar where we're going to be discussing physical and emotional safe spaces, theory, practice, and measurement. And I was actually reflecting with Chris just before we got started. This was a really interesting presentation for me to put together because this really encapsulates a huge body of the work I've done, both as a researcher, but also actually when I was reflecting in regards to the sort of practice I led. So yeah, it's been a really interesting, actual reflective piece of work pulling this together. And I'm really interested to see how people find this, what you're interested in, some of the questions that come up. I really want to caveat, I'm not here with all the answers. I'm here with a really interesting point of discussion that I think we should be discussing with a lot more intention in our various spheres. And also a big welcome. I know there's quite a few people on the call who maybe aren't from a surf therapy background who have come through the various other networks who are kind enough to share this webinar. And yes, this concept of physical and emotional safe spaces is something that absolutely transcends surf therapy. But before we get too far into that, just a little bit about me, which Chris very kindly covered a lot of it for me. Yes, so my name's Dr. Jamie Marshall. I'm a senior research fellow at Edinburgh Napier University in the School of Applied Sciences. I am the chair of the board of ISTO. I'm also the social and health innovation lead at Lost Shore Surf Resort, which is a great fun role, which I've not been getting the pool enough recently. I do need to remedy that. I also work very closely with the Take 5 initiative, which is a fantastic physical activity-based program that supports young people's mental health across a range of contexts around the world, led by Ways for Change. But that's been a really fascinating piece of work for me, because that is where we really have taken things we've learned from surf therapy and applied it into very different sport modalities and contexts. And more recently this year, I joined the Olympic Refuge Foundation think tank, which again has been a really, I've really enjoyed that, and it's been a chance to connect with and meet lots of new people doing very, very exciting work. But as Chris mentioned, my work started with the Wave Project. And I share this picture all the time. It's my favorite headshot, because why have a boring headshot? A very close friend of mine, Alison, took a picture of this one day when I was helping out on the project, and seaweed beards are a fantastic way to sort of break the ice with a young person who's not sure if they want to engage. And actually, the reason, sort of more than ever before, this picture is really relevant, because without knowing it at the time, when I was doing silly little things like this on the beaches in Scotland when I was running the project, I was living and breathing safe spaces. This was about trying to help young people feel comfortable, about trying to help through shared humor, through silliness, through various other things, trying to meet them at where they're at. And I certainly didn't know I was doing that from any kind of theoretical standpoint. I just put some seaweed down my wetsuit once and it made some people laugh, and that seemed to be a good thing. So I'm certainly not coming to you saying I've got everything figured out and that all this theory we're going to be diving into is complete. A lot of this comes through trial and error, and there'll be lots of expertise that you and your organizations have around delivering safe spaces that I'd be fascinated to hear more about, little anecdotes like that about what works for you, because that's really important. But before we get started, I'd like to do just a wee little thought experiment. And I want you to reflect on the activity that you're involved with. So, for example, if you're in a surf therapy organization, maybe it's surfing. If you're in a different organization, it could be something like football or soccer or another activity, yoga, whatever it may be. And I just want you to reflect on that activity. And I want you to raise your hand, hit the raised hand button if you feel comfortable doing this. I want you to raise your hand if you've ever felt unsafe or comfortable taking part in that activity for any of the following reasons. Have you ever been made to feel uncomfortable when you're surfing or taking part in an activity due to your gender, due to your ability, due to your ethnicity, due to your financial position, due to anything like that? I can already see lots of hands going up. This is an exercise I often do when I'm speaking in person. And I think it's really, really important that we're aware that these spaces that we're holding to support people's mental health are not inherently safe. Surfing is a really, really famous, there's some famous examples of surfing not being great at this. Surfing actually is the context in which I've seen the most overt sexism I've ever seen in my life. What I would almost call sexist violence. It really is one of the places where I've seen it worst. And I'm utterly ashamed to say that. Surfing and the surfing world is something that means a lot to me, but we have a real problem with safety in surfing, and it's not just sexism. There are a number of other sort of issues around it. And I think surfing is often presented as this very spirit of aloha, very happy, very romantic concept that actually, it's all happy clappy, everyone's cheering each other on the back. And it's just not true. And we need to recognize that, and we need to own that as surfers. But in the last few days, there's been a few instances that have made me reflect on this isn't a surfing problem. This is a sport problem. And I want to just share this picture, which was from the World Cup bronze medal match. And it was after England beat France. And a group of the players came together on the pitch and had a little prayer circle together. And I remember seeing that on the TV and just going, wow, that's everything FIFA wants to talk about with sport. It's about people coming together. It's about shared experience. It's about all these wonderful things that FIFA have, to be honest, been talking about non-stop over the past couple of weeks. And it was great to see an example of that on the pitch. However, 24 hours later, at the final whistle of the World Cup final, we saw some quite different behaviour. For anyone who wasn't watching, there was some quite poor reactions by members of the losing team that actually turned into some violence. And quite frankly, for me, that sort of, and I totally understand there are things around competitive sports at the highest level. I'm not going into the psychology of competing at the highest level. But for me, seeing that sort of the difference between those two examples was really powerful, because it did show that, you know, when sport is done the right way, it can be this really powerful thing. But then just 24 hours later in a very similar circumstance, it was the complete opposite, you know, right the way up to sort of physical violence. So this idea of sport not being inherently a safe space is not a surfing issue. It's very much a sport issue. And it's not always just the people involved. A lot of the time, the things that undermine this sort of safety and this ability for sport to be everything it can be, they can also be environmental. And this is a picture from an organization I work with called Elm Peace in Somalia, where the realities of the conflict that has been going on in Somalia for a long time is often never far away. Even when you're trying to go and get your surf, you're trying to do the thing which gives you respite. The realities of those environmental elements, be they, you know, challenges to physical safety. I mean, there's firearms in this picture. You know, that's very much a challenge to physical safety, but also there's issues around political division. More and more, we're seeing the impact of environmental disasters. So there are also these environmental challenges to our experiences within sporting-based interventions. And I actually said it just now. What I'm trying to get at in these examples is sport can make a difference, but sport does not inherently do that without additional structuring. In my work with the Olympic Refuge Foundation, there was a bit of a sort of exasperated sigh and chuckle in a meeting where I really stressed that can element around some messaging. But actually, everyone in the room did also agree. They were chuckling because it's typical academic behavior to get that caught up on one word. But actually, it's totally true. Sport can make a difference, but only when it's done the right way. And when we try and unpack what sport looks like the right way, I like to reflect back to this, which is a logic model from my first ever published paper in 2019. And if I'm honest, when I look back at this, I do cringe quite a lot. You know, it's like watching it's like looking at a painting you maybe did at the start of your career. There's probably quite a lot you'd pick out of it. But you'll see there in the core categories, this idea of a creation of an emotional and physical safe space at the beach. Even back then, in my first ever piece of work, trying to understand, as Chris already mentioned, I was always fascinated right from my work on the beach with young people. I was trying to understand the why of surf therapy. And right in those earliest explorations, we saw this idea of the creation of an emotional and physical safe space at the beach. And I'm not really surprised by that, because, as I mentioned, it was something I'd lived and breathed on the beach. Here's a very old picture of a much younger and less tired young wave project coordinator. And yet, safe spaces was something we did. We didn't necessarily call them safe spaces. We weren't necessarily super aware of the steps to doing them. But there's an anecdote I always tell about the wave project, about a young girl who came along to the project. And the first week she came along, she came down to we literally had to get changed in the car park in the early days. And she came down to the car park, and I come and had a little conversation with her through the window in the car. And that was enough. That was enough for her that week. But I could tell, and through speaking with her mum, that was actually a huge step for her to come down and talk to someone new. And that was fine. The next week, she came down, and she came down to the beach, didn't put a wetsuit or anything, but came down just to see what was happening. And I was working with all the other young people, and I came out and had a little conversation with them on the beach, went back in, she got to see things, and away she went. She didn't get in the water that time. Next time we got a wetsuit on, and we just had a little paddle, no boards, no nothing. And you can kind of see where the progression goes. The mum of that young girl said to me afterwards, she has never engaged with the program the way she engaged with the Wave Project. And this was actually this young girl engaged with the Wave Project Surf Club for years afterwards. And she just never engaged with anyone before, because she'd never felt that supported and that met where she was at. She'd never felt that safe. in the way in which we paced everything, the way in which we made sure it really was a sort of participant-led experience. And now I can really speak to, wow, we were doing safe spaces really well in that instance. You know, I didn't call it that back then. It was just like that felt like the right thing to do. But I think it's unsurprising that my work has become so focused on this, because even back then there was this recognition amongst me and my colleagues at the Wave Project that this was something that was even more important than surfing. If that young girl hadn't been met where she was, the surfing never would have mattered. It was only because we went through that process. So now I want to move to a more, we've looked at my early sketches, shall we call them. This is a much more well thought out, well researched piece of evidence from the wonderful Nick Knowles. This recently came out. If you haven't read the paper, I've got a little bit of bibliography at the end where you can snap all of the references. So don't worry about grabbing them just now. But please do go read this paper. It's fascinating. And even if you're not from the surfing side of things, the way in which Nick has mapped the sort of the process of effective surf therapy, the nuance behind it is so transferable to non-surfing based modalities. But one of the things that is really, really encouraging for me is when we look at the intervention, safe spaces, and the text is quite small in this, but the only bit I really want to focus on is that blue box that surrounds the intervention. And that was Nick's way of highlighting how safe spaces are like this fundamental, this foundational mechanism that supports the other elements. Without the safe spaces, the social elements don't work. The surfing, the physical activity don't work. If you don't feel safe, you're not going to go surfing. You're not going to play soccer. If you don't feel safe, you're not going to engage with other people at the program. If you don't feel safe, you're not going to engage with the psychoeducation that may be built into the program. So I thought it's just been so nice to see in this, and this wasn't a piece of work that looked at one intervention. This really mapped across multiple interventions what was out there in the evidence. So seeing safe spaces really establish themselves as this foundational mechanism has been a real sort of, especially in somebody else's work, has been a really, really valuable thing for me to see that, yes, we're starting to understand how foundational this is and how we need to keep working on this. As we go on to the next bit of the webinar, I'm going to be talking a little bit about the research we've done specifically into safe spaces. So up till now, I've kind of been talking about the journey that led to why I got so interested in safe spaces. So obsessed, some of my colleagues might say, but we all have our things we like. I'm going to be talking a lot about a piece of research I did with the wonderful Professor Russell Martindale, where we really went to map what safe spaces looked like from the perspective of the best experts we could find at the time. We did this in what was called a Delphi study. Now, a Delphi model is a really useful piece of methodology. I do encourage you to go look it up if you're interested. It's a really good way of building guidelines for practice. And what it is it's an anonymous panel-based program. It was actually developed in the Cold War. So I think it was developed in the West in the Cold War to try and use experts to try and predict what was going on in the various arms races and spying and all of that sort of stuff. But essentially what happens is you start with a series of open-ended questions around a particular topic that gets asked your expert panel, and then based on their responses, you build up statements, and each round you accept statements if the same panel then agree with them on a sort of rating scale. And this goes around several rounds until you get to your final set of consensus statements that form your guidelines. It's very commonly now used in medical practice. So, for example, when surgeons are looking to develop guidelines around a specific procedure, they'll often use a Delphi with the top surgeons in this area in the world to create these guidelines. So it's a really useful method, but actually it's a very easy method to do. So if you are interested, it's something that an organization could actually do quite well to build guidelines for themselves based on the experiences of their participants or their coaches or similar. So if you are interested, it's called the Delphi model. Definitely look it up. But the main thing that you have to get right with a Delphi is to get your panel right. It's to get the experts, the right experts into the study, so you get the right insight that builds it out. And we had this really, really amazing panel built up of organizations who are using sport to support mental health in a wide range of contexts around the world. And the other really cool thing about this is this is not a surfing specific piece of work. There are some very well established surf therapy organizations in that list. You can probably see Ways for Change down there, Ways for Hope in Trinidad, and actually HIV Generation there in Kenya. We're also using surfing at the time, but also we've got some other big organizations. You may have heard of Skaterstan before. Do amazing work in South Africa. They do a lot of work in the Middle East, although that's been quite challenged with certain, especially their work in Afghanistan. I think it's been quite challenging recently. We've got a couple of football or soccer program moving the goalposts. The Watford FC Community Trust. I actually grew up as a Watford fan, so it was really cool that they got involved. There was no bias in their selection. I have to quickly caveat that they met the sort of thresholds for inclusion. Climate do amazing work with climbing. Elm and Peace do multi things. So you already saw they do surfing, but they also do yoga and a range of other sort of physical activity elements. Mike Trainer do netball predominantly, along with some other things. Lost Boys in America, they use baseball. I've never played a game of baseball in my life, so it's fascinating sort of hearing their insights. Street Soccer Scotland do amazing work with people who are either homeless or at risk of becoming homeless in Scotland. And actually, there's some comparable programs around the world that do amazing things and do a homeless World Cup, which is just the most amazing event. And the one I'm leaving for last is the School of Hard Knocks, who are an amazing organization who use rugby to support people with mental health and a range of other things. And actually, I love bringing up the School of Hard Knocks because I think they do brilliant work. But rugby, on the face of it, probably seems like the least likely sport to be having a discussion about physical and emotional safe spaces with. I played rugby growing up, and there were definitely moments where I didn't feel very safe. But it's highlighting that all of these sports, they're all modalities. They're vehicles to achieve impact. And the best placed sport, if delivered poorly, is no use. And equally, sports like rugby, which at face value might not seem something that you'd be able to adjust to this, actually, when they're delivered in a really thought out manner, when things like safe spaces are implemented correctly around them, they can have these amazing, amazing impacts. So I think it's really, really important to highlight that sport is the vehicle, because if we drift down that sort of road that we were touching on before around romanticizing sport as this has certainly happened in the World Cup over the last couple of weeks, this idea that sport will fix the world's problems, it absolutely will not. There's a touchstone paper that I always talk about, which was Justin Richards and Charlie Foster did an RCT in Gula in Uganda, associated with a football program, and it found that actually amongst those, and it was a really robust RCT, randomized controlled trial, sorry, jargon alert there. So a really robust trial comparable to the kind of one you'd use for a drug trial. And it found that the participants who took part in the football program actually got worse in terms of their mental health. And actually, a lot of what Charlie and Justin talk about in that paper, but also they wrote a really good book chapter about it. They talk about poor implementation and poor fidelity of the mental health components, including elements that I would certainly link with this idea of physical and emotional safe spaces. So that's kind of the study. That's what it looked like. What did we find? Well, the most important thing I want you to take away from this is physical and emotional safe spaces are really complicated. That's not here to scare, that's not here to do anything like that. But I think in wider literature, especially in things like mainstream sport promotion, things like that, this idea of physical and emotional safety often gets boiled down to either just safeguarding, and safeguarding is a hugely important part of a safe space, but it is not the only part. Or it's this idea of we just have to be nice. It's not enough. I'm speaking to a room. I'm almost preaching to the choir here a little bit. Many of you run organizations that I know you are experts in delivering these physical and emotional safe spaces. And to you in particular on this call, I want to say just well done for the work you're doing, because it is really difficult. There's an awful lot of things that can hinder a safe space. And there's a lot of things you have to put in place long before a participant ever hits the beach or the pitch or whatever it may be. before these safe spaces can be enacted. And I was trying to look for an analogy to really try and dive into this. And I was reminded of the first time I was at an aviation museum in Scotland, and it's very cool. They've got one of the Concords up there, and I have a cool family link. My sister's godfather was a Concorde pilot, so I always heard these cool stories about Concorde, but I'd never sort of been on one. And I went to the museum, went along, and this is the view when you look into the cockpit of Concorde. And I remember my reaction when I looked into that cockpit. I was like how? Like, that looks impossible. The idea that someone could fly something at twice the speed of sound that needed all of this instrumentation. I mean, that is a mind-boggling amount of instrumentation. You know, Concorde's quite an old plane. These days, you know, a lot of this instrumentation and stuff, that'd all be hidden behind computers. So you'd never have that visual representation of the complexity of flying this plane that you would now, because it'd all be behind screens. But yeah, it just blew my mind. And actually, when I was thinking about it, is people who don't know safe spaces, this is the message I want to get across to them, is actually effectively delivering a safe space, especially for a vulnerable population, especially for a population who's potentially been through all kinds of difficult circumstances. It's a lot more like this picture than it is, you know, it just being a decent person. This is much more aligned. And the analogy is going to track further on. But yeah, I just wanted this idea of this complexity. It's what I want people to take away. But I don't want that to be taken away as a scary thing. It's a challenge to us to get that right and to continue to learn. So we found within the paper, we built these consensus statements and we framed them in different sort of themes. And one of the first themes was this idea of safe space characteristics. And what I'm going to do is I'm going to go through each of the themes, and we're going to touch on a few from each theme just as examples. But the characteristics, this is the only grouping where I am able, just for space on the screen, to share that sort of whole lot. And these were the core characteristics we identified that aligned with these expert coaches' opinions on how to deliver effective physical and emotional safe spaces. And I really like these characteristics because we're going to get into much more specific things around program structure and coach behaviors in a minute. But these safe space characteristics, they're the key building blocks for creating a culture that really values safe spaces and implements them with intention. And I think these characteristics of safe spaces provide a really nice touch point for sort of everyday activity, for planning, for implementation, for all these sorts of things, to understand if the work you're doing is aligned with the concept of safe spaces. When you're planning a new activity or a new change or something like that, just touching back to these points is a really nice way to go, actually, is this aligning with this idea of holding a safe space for our participants? And a lot of these are really useful. And the other thing that's really important, a lot of these are buzzwords that are often talked about in the sort of sport for development space, but aren't actually delivered very well. Especially down towards the bottom, this idea of being collaborative and equitable. They're words that people talk a lot about, but actually in practice, they're very hard to deliver. And therefore, I do think sometimes they get overlooked a little bit. But yeah, have a look at some of those. Some of the ones that have always stood out to me is this idea of being free from judgment and patient. That very much speaks to the anecdote I shared about the little girl who came to the WAVE project, meeting people where they're at. This idea of being inclusive and accepting is another one around. I always enjoyed, one of the nice things about the WAVE project, and it's still to this day, is it's not a sort of diagnostically exclusive intervention. Lots of people go along for lots of different reasons. And I always remember that was really powerful, because I had a little boy who was referred to me by the Edinburgh Oncology Ward. So he'd been dealing with quite a few cancers in his life already. He was only 8 years old, and I think he dealt with several already, which was incredibly hard. But he really enjoyed the WAVE project, specifically because it wasn't a cancer project, because he was accepted there as a surfer rather than as someone whose life to that point had been fairly dominated by being a cancer patient. So these ideas of inclusivity and accepting and supportive elements, I don't think there's anything on there that's especially controversial. I don't think there's anything that any of us would disagree should be up there. A lot of these things align with just being a decent person. But when we have these established in a framework like this and becoming touch points for us to be able to refine our work, that enables us to make sure that we're holding safe spaces with fidelity and consistency throughout our operation. It's very easy to do a safe space really well in a one-off event, but doing it every day when your coaches are going to have good days and bad days, when the weather's going to play ball sometimes and not, when you're going to have all kinds of barriers or hiccups or curveballs get thrown, building it into a culture of physical and emotional safe spaces, physical and emotional safety for your participants, but also for your staff, is the way to really entrench that in a positive way. And one of my favorite examples of this is from my PhD. I did some work with Ways for Change in Liberia, most amazing project, a beautiful part of the world. And I always remember this quote. It's one of my favorite quotes I've ever had in any qualitative research I've done. And it says, if I'm a surfer, I would learn how to shelter each other, I would learn how to communicate with each other, and I'd learn how to protect each other. Once I'm on top of the water, I'll be able to surf better because everything is fine to me. What I love about that is for the participants in that culture of physical and emotional safety, of support, of looking out for each other, that has become the definition of what it means to them to be a surfer. It's nothing to do with their performance on the waves. It's nothing to do with, the size of surfboard they're riding. Or if we were to take this to another context, it's nothing to do with how many goals they're scoring or what position they're playing on the pitch. The actual identity they associate with the sport is around how they behave and how they interact with their fellow surfers in this case. And I just thought that was so powerful in showing that when you do effectively implement a culture like this, the way it translates into in this case, young people with, is so powerful. And I could go on about this project for a long time. I've got lots of stories about how that culture then led to long-term change with these young people being able to emotionally regulate better, being able to manage the quite significant daily challenges they were facing. So yeah, building this culture into something that really lives and breathes within your program is such a huge thing to do. And it's my hope that the characteristics we've identified help you to do that. We also got into some very specifics, and again, I've just picked out 4 or 5 here. I think I had it on one of the other slides, but we had a lot of consensus statements in the different groups. I've just picked out a few examples here. As we said at the start, like as I said when we were talking about the plane and this anecdote for how complex safe spaces are, they need to be built into your program structure. So that includes pre-planning. That includes a long time before a football is kicked or a surfboard is taken into the water. And there's some really clear examples about them. Some of them are very much around physical safety. That top one's around risk assessment. Risk assessments have to be done not as a checkbox exercise. We all do have to do risk assessments, but really taking into account what could undermine your participants' experience. That's a huge risk as to whether they're going to come back, as to whether they're going to make the most of the other working ingredients, the other active ingredients of your program, including weather planning. Surfing's a huge one for that. Always need to have a weather plan. The number of times I had brand new young people and there was like a 6-foot shore dump, and then the days where I've got my experienced surfers wanting to ride bigger waves and it was flat calm, that's surfing for you. But then in terms of that physical safety, like actually your location. So a secure location that provides a barrier to an external intrusion. We'll come on to external intrusion in a little more detail later. So these physical elements are really important. And I actually think it's really important. A lot of the time, we can get very focused on the emotional safety, but the physical safety is just as important. Actually having a space where participants can feel physically safe can be and this is potentially quite an upsetting thing to reflect on, but that can be out of the norm for our participants. I remember a piece of qualitative feedback I got in one of my first years running the Wave Project, where a young person just said, I love coming to the Wave Project because I know I won't get beat up. And that to me was quite like, oh my goodness, what is the rest of your general life lived experience that is your threshold for why you like it? And actually, we have to remember, especially working with populations that potentially are facing violence or where physical safety is not the norm, we need to be aware of that and actually make sure we're really as focused on that as we are with some of the more emotional safety elements. And as I mentioned before, really doing physical and emotional safety well, you need to think about your staff as well. And each of these, I've tried to choose the picture with some intention. This is a lovely shot of Ways for Change, doing one of their sessions down in South Africa. And one of the reasons I chose this is Ways for Change are brilliant about providing professional support to their staff, because they know their staff are going to be exposed to things through conversations they have with young people, through situations they're exposed to and they're expected to manage. They know they're going to expose things, so they provide the support the coaches need to feel physically and emotionally safe and supported as well, because if they don't feel that, there's no way they can provide that to the young people. So it's not just, safe spaces are not just thinking about your participants, but thinking about your staff, thinking about volunteers, thinking about your program in a holistic manner. And then other elements around. As I said, if I were to go through all of them individually, we'd be here till tomorrow, which, as interested as I'm sure you all are, none of us want that. So the next element to touch on was this idea of coach behaviors. And coach behaviors are probably one of the most significant. All of these elements need to come together for effective safe space implementation, but coach behaviors are probably the most forward facing, the most front facing, the most under the scrutiny element when it comes to this, because I kind of touched on this earlier. Even a good coach on a bad mind perceptions of safety, if they're just having an off day, if something's going on in their wider life, and that's no critique. That's why we need to make sure our coaches are supported. But yeah, again, some of this is very much focused on elements of physical safety, so appropriate physical boundaries. That can be quite contextual in certain cultures. You know, a high five or a hug may be suitable and others not. So again, a lot of these guidelines we developed consensus across multiple different contexts and cultures around the world. And that enabled us to make sure we got these points across around maintaining appropriate physical boundaries, but recognizing that that doesn't necessarily look exactly the same all around the world. And that's important as well. There is nothing in any of these recommendations we made as part of this paper that is prescriptive, that is telling you exactly how to do it. It's always around, and several of the recommendations, the consensus statements, actually speak to that necessity of contextual expertise. Your coaches need to be contextual experts in what they're doing. One of the recommendations is around coaches actually coming from the communities they serve wherever that's possible. Again, the second one, I think, is probably one of the most interesting ones to unpack how it looks, especially across different sports modalities. So this is one where the rugby element is really interesting. Coaches should appropriately manage competitive elements of activities to ensure they don't undermine safe space provision. I have to be very clear on this because I've been accused of this in the past. I'm not anti-competitive sport. There is definitely a time and place for a game of football, you know, where inherently within a game of football or soccer, sorry, if I'm aware I'm speaking to a global audience, there is a winner and a loser in a game of football. That's fine. That can be managed within the context of physical and emotional safe space. In a game of rugby, there is a winner and loser in every element of contact. You know, that can be managed within that sort of within that context of the physical and emotional safe space. And that's where I'm really passionate about engaging with coaches on these concepts, because I can't tell a rugby coach how to do that. I love rugby. It's one of my favorite things in the world to watch, but I have no coaching expertise. However, if I can have this discussion around physical and emotional safe spaces, why they're important, and these kinds of elements of coach behaviors, you then start seeing the light bulbs pinging off with the coaches around how they could adapt drills or exercises, or how they could create new games that actually, they have the rugby in it, but also build on this point you're talking about. Because our coaches are passionate, they're experts, our surf instructors, our football, soccer, rugby coaches, our climbing instructors, our skate instructors, they are the experts in their sport. They're passionate about their sport, and they are so keen to learn how to best implement the sport. And that's where getting these discussions around physical emotional safety is so important to have, not only with program leads and program coordinators, but also with the coaches, so they can innovate and create these amazing new. Every time I get to work with a new partner on the Take 5 project, the innovation, it's one of my favorite things, hearing about the new innovations they've come up with, the new games they've come up with, the way they've adapted something we previously developed alongside surfing into yoga or into soccer or into whatever it may be. So yeah, I love seeing that innovation, and it's our hope that this theory then drives that innovation rather than stifles it. Coaches role modeling behaviors, absolutely huge one. And again, that idea of coaches being held to the same standards of behavior of participants. There's that equity built into the program, you know. I remember actually having to deal with it with an external surf instructor once, where you know we asked young people if possible not to smoke during the sessions. We occasionally had exceptions for certain reasons, but like we'd ask them not to do that, just out of respect of their peers. After they're changed and finished in the car park, that's fine. But at the same time, I then had to, you know, I had a surf instructor doing that and then smoking in front of the kids. Now, I'm not an epidemiologist. I'm not going to go into smoking and pros and cons of that. But that holding the coaches to that same level of behavior is so important. And again, I've chosen this picture with some intention. Because just to highlight the level of detail that we have to go into when it comes to delivering safe spaces effectively. Survivor here in the Netherlands are actually, and this picture was not sent to me with this purpose. I was sent some cool pictures and I went, oh, that's a good one. The instructors are there in the black rash vests, and you'll notice there's one instructor at the front leading everyone they're going, but there's also an instructor at the back, just making sure everyone is comfortable, you know, no one's falling behind. And that's such a good example of sort of micro practices that all feed into building these physical and emotional safe spaces. That seems like such a silly little thing, but actually making sure no one is left behind speaks to so many of those characteristics we talked about at the start. It is a coach behavior, that it is role modeling. We're not leaving anyone behind. So yeah, I really like that picture for that, and I'm very grateful for Ben sending that to me. He certainly didn't know I was going to dissect it like that. So yeah, thank you, Ben. One of the other elements we focused on were barriers to safe spaces, and some of these are very environmental. Within surfing, you know, the state of the beach can be a real one. I know countless surf therapy orgs that have had issues relating to the cleanliness of their beaches, and it's an issue that isn't getting any better. But yeah, just making sure we're risk assessing, and it ties back to some of those structural elements, trying to make sure we're avoiding inappropriate behaviors from non-program individuals. That's quite a significant one. People just wanting to get involved or shouting in on the project. I had a kite surfer decide, despite having a whole beach to surf on, decide to carve right through my kids on a session, and I'm certainly not going to repeat in this public forum what I said to him afterwards. But yeah, you need to try and mitigate and control for these things which might undermine your participants' experiences of safety. Changing spaces, things like that, again, really, really important. And it's important to understand, we understand that not everyone can afford to get a new building built with custom spaces, but you can do creative things around staggered changing. There's all kinds of elements you can do to overcome these barriers, but it's important to be aware of them. I really encourage people to map these out, like really map what barriers you might face, and then have your mitigation in place long before, again, a football hits a pitch or a surfboard hits the beach. But it's not all about the sort of how we create safe spaces. We also got these amazing consensus statements on the perceived benefits of safe spaces. And actually, what was really interesting is a lot of these perceived benefits from these sports coaches of various sports interventions around the world were not sports specific at all. So they were actually talking about things that were not. It wasn't just a safe space was making the surfing or the soccer or whatever it may be better. It was actually having these inherent things around. I always think the second one there around youth participants, the chance to be children. Adultification is a real issue that comes up in a lot of contexts that we are working in as sports development actors. And just having that space, that minute for young people to just be young people and get that respite and all of those elements is absolutely huge. So we come back to Concord's cockpit here. And again, I'm not here to lecture you and scare you around, oh, well, we should just give up because it's impossible. But there's a lot of really nice parallels to how they used to fly this plane and how we can make safe spaces more manageable. So with the right structures in place, so for example, well-trained coaches, it takes a lot of training for a pilot to get anywhere near the steering. Just the same, our coaches should be going through the right kind of training, the right kind of practice, the right kind of workshopping and scenarios before they actually ever get near the implementation of our interventions. Things like pre-session checklists, checking the state of the beach or the pitch, checking all these things. It's just like on a plane. There is a huge list of pre-flight checks they do. And that means that you're not looking at all of these dials and gauges in a way that's overwhelming. You're going through a systematic process to work through what you need to do. So having those systematic processes in to ensure our safe spaces are being delivered is really, really important. Regular maintenance of kit and personnel. So regular training, regular maintenance of the kit. Planes go through lots of maintenance, and the right policies in place. So we've got policies around things like safeguarding. We've got policies around coach behaviors. We've got all these sorts of things in place. Just as pilots, it comes up in the news when a pilot breaches a policy that might endanger, it's very common. The most common one is obviously, a pilot walks onto a plane and smells like he's had a drink or two. There are very strict policies in place to prevent that leading to harming people on the plane. Just the same, Justin Richards and Charlie Foster's paper highlighted, we can actually harm our participants if we don't have these policies in place and if they're not actioned. So actually, thank you for bearing with me with the analogy, but the analogy is really nice. Safe spaces can feel like this overwhelming list of dials and buttons, but when we break them down, it becomes a lot more achievable, a lot more manageable in the day-to-day. And one of the issues around that is up till now, we didn't really have any ways of effectively measuring safe spaces. We didn't have the dial. We didn't have I actually don't know. I don't know any plane dials, but whatever dials are on a plane, we didn't have any of those available for us to just check on whether those safe spaces were being implemented correctly. And recognizing how important this was to ensure the fidelity of safe spaces, myself and Russell and some of my other colleagues at Edinburgh Napier developed what we've called the spaces scale, which is the safe physical and emotional spaces scale. I'm going to say right from the onset, this is completely free to use. We've hopefully got a publication around the validation coming out soon. There's a full-length scale at 35 items, and this is a snapshot of the first 11 items of that, and a short spaces scale of only 7 items, which is useful to get a snapshot. This is something that's designed to explore safe spaces from the perspective of the most important people, your participants. So it's designed to be done with your participants. And I've included, I think Russell was on the call. This is Russell's stats on the right here. To me, like, it might as well be in French. He's an absolute wizard when it comes to these things. But what we're doing when we're statistically testing a new measure that we've developed is we're trying to make sure, first of all, it's valid. And what that means is it's measuring what we intended to measure. It is actually measuring safe spaces. So you can see on these sort of bullseyes here, something that's valid is a nice tight grouping. You're actually measuring what you mean to measure. The other thing we need to track is it reliable? So is it something that's going to measure this consistently over time? The center of the bullseye is your validity, and then the grouping is your reliability. So you've got the top right there. It's unreliable because they're all over the place, but you are hitting the target most of the time. Whereas the bottom left there, it's super reliable, but you're not actually hitting the center of the target. So are you actually measuring what you went for? So there's basically this complex statistics that Russell could give you a whole lecture on, and it would be it'd be a wonderful lecture. He does do a brilliant lecture. I'll be talking about how you can access one of those very soon. But that bottom right one, we're measuring what we want to measure, and we're measuring it with reliability. And as part of those statistics, we actually unpacked, this came from the stats, this came from the numbers, a way of actually better understanding the structures of safe spaces, the way in which they break down. So we've got our safe space at the top as a broad concept, but then we've got this idea of supportive environmental safety versus the social relational safety, and then much more individualized elements before, that all aligned with the previous work we've done in the Delphi study. And very usefully, this helped us identify where the spaces scale might be useful for you as a practitioner. So if you're just looking for a snapshot, at level 1, you've got the spaces scale short, just gives you that snapshot. But you could also use it for an in-depth look. You could use the full length one. For those of you looking to do some more complex science, level 2, we have a statistically valid dual structure of physical and emotional safe spaces, which is really interesting to analyze. Again, that's really designed for those robust quantitative studies. And then with these individual elements, the use of the full spaces scale, you explore maybe what elements you're doing really well in, but also what elements maybe you could improve with. So you may be doing quite well in your safe spaces with your total score, but actually if you dive into these themes, you may be able to identify, well, you know what, on that non-judgment element, we could do a bit better. That was our lowest score. Maybe that's something we're going to work on in our workshopping for next year's intervention delivery. So the instructions how to use the spaces scale are all included with it. I will once the paper's published, it will be publicly available up on a website. However, if you want to use this before then, or you want to have another look, just email me and I'll send you a copy directly. So coming back to Nick's wonderful study, we now have a way of measuring that blue box, that foundational mechanism. And that's really, really important, because however much we want to dive into some of the further down the road elements, if we're not nailing that fundamental mechanism right, and we don't know that, we could be lost in the weeds of actually what's going wrong with our intervention or what we could improve. So the idea of the spaces scale was to make sure we could check off that most foundational element of physical and emotional safety is being delivered effectively. And once we know that, we can then look at other elements of the program that need support or needs refinement, or maybe you're doing everything perfectly, which is great. But being able to demonstrate this is really important. And also actually being able to demonstrate something so foundational to funders and policymakers in terms of delivering physical and emotional safety with fidelity is hugely important. So being able to finally check whether that's working is so useful. So what's next? Well, as I stressed at the start, I'm not here with all the answers. I'm continuing to work in safe spaces. I'm currently doing a piece of research with the Olympic Refuge Foundation, specifically looking at physical and emotional safety within displaced persons. The current work is a starting point for reflection. There's so much knowledge in just in this webinar, and we're just a tiny drop of the knowledge that's out there in terms of the world of implementing these things. But I really want people to be able to start talking about this and start reflecting on this with a lot more intention, recognizing how foundational physical and emotional safe spaces are towards any kind of implementation within mental health. And it has actually been pointed out to me by several people that this isn't something that is unique to the sport for development world. Physical and emotional safe spaces translate into a huge range of other paradigms, whether it be sort of social care, education, but we really need to start talking about these with intention and confidence that these are really important things. Safe spaces are something that have been somewhat caught up in recent culture wars in terms of the idea that talking about physical and emotional safety is some kind of woke thing that we don't need to do. To be honest, when my work gets labeled woke, I take it as a compliment. But yeah, just actually recognizing no, we need to get this right, and there's a lot of science, and actually getting the science to join up on this. So I very much live in a sort of psychosocial space, but actually linking in with some of the neuroscience around this and getting us all to develop this cohesive framework in which physical and emotional safe spaces can exist is really important. And it is happening. I'm excited by this. I was sent this by my good friend, Dr. Simon Rosenbaum, just last Friday. He was at a United Nations Youth Office, One World, One Game, One Goal, big event at the United Nations. And in this video he recorded, he sent me, he knows anything to do with safe spaces just makes my day, so he sends it to me. But what they actually said, and to hear this being said at a podium at the United Nations, for many young people, safe spaces, facilities, and training mentors for sport simply don't exist. For the UN to be recognizing how important that is, fills my heart with so much joy and encouraged me to actually keep going with some of this. And it's this recognition that this foundational mechanism for sport and development is finally being taken seriously after decades of, to be honest, it not being in the limelight, despite a number of notable researchers really pointing towards it. So it's really encouraging to see those conversations starting to pick up the momentum they truly deserve. In terms of just next steps, there's a few things. As I said, the physical and emotional safe spaces scale, I can make available to anyone who wants to try it, use it. Please do use it. We want your organization to use it, feed it back to us. The instructions for its use, how you analyze it, how you score it, are all available. They're on the sheet, so you don't need an academic researcher to help you with anything. The idea is it's as useful to you as program delivery individuals as possible. And we'd love to hear how you find it. We're currently working with FIBA. So FIBA are the equivalent of FIFA, but to basketball. So it's the Federation International Basketball Association. I think I've got that wrong, but we're currently working with them to explore translations of the spaces scale into multiple languages, which is really, really exciting because we totally understand that English is not a first language for everyone. And yeah, we're really excited to continue developing that project, and we'll keep you up to date with that. And if you are interested in diving into safe spaces in more depth, we developed based on all this research we've discussed in this hour, we've developed a piece of online CPD available at Edinburgh Napier University. It will cost you £10 plus VAT to do it as an individual, so that's £12. If you are based in LMIC, it's half that, so it's £6, about $8 for you to do it. You do it completely online in your own time. We're quite proud of it. I think it's really useful, and the whole course is designed to help you reflect on this theory and how it applies to you and your organization. If you're part of an organization who might be interested, please get in touch because we can do big organizational discounts. Apologies for the sort of blatant plug. This money certainly does not go into my pocket. The money sort of maintains the course, keeps it going, and actually any money we make on top will allow us to invest more money into it to get it translated into different languages to continue to update it. So if you are interested, we've tried to make the costing as accessible as possible. But yeah, if you are interested, either reach out to me or have a look. You could literally go and book it right now on the Edinburgh Napier website. So I do apologize for the blatant plug, but if you have enjoyed this lecture and want to go in more depth, that's the perfect place to do it. So on that note, I just say a big thank you. I know I've run over a little bit, so and this is a safe space. If you need to leave on the hour, there is no judgment, there is no nothing. Please feel free to. But I will hang around for as long as we've got any questions. So yeah, big thank you, stay safe. And there are all the references if anyone wants to take a screen grab. But yeah, more than happy to answer any questions.
I'll come on real quick while people are thinking about that. And actually, I have questions because I have taken the course. So one, I'm actually going to share that link to sign up for that course when I send the recording out. So you don't have to try to go find that safe space course, because I'll share the link in the email that's going to go out to all of you.
Chris, I will give you the spaces scale to send as well. And then everyone can have
Oh,
that.
yes. And then, of course, the spaces scale. So again, I'll let everybody think about that for a second. I did take it. So Jamie, I had these questions and I felt like actually these questions are really interesting because I feel like I know not everybody on here has yet taken it. I hope Russell is still here since he had a part to do with it. But I guess it's kind of twofold. So one of them is obviously safety can feel so subjective, and you talked about that right in the context. And so I guess the question would be, one, where do you think the scale still has room to grow? Because it is so subjective, right? Personal, emotional safety. And then the bigger question is, you mentioned it's kind of built for practitioners and coaches and researchers. And so since the spaces scale, like your course has been validated, what does the path look like forward? And this is what I mean. Do you see it becoming something that programs can use as an accreditation or funding conversations, or is it more of a self-reflective tool for practitioners to improve their own practice?
Yeah,
that's what I was when I took the course. So yeah.
Yeah, no, the spaces scale for a start there's always room for refinement. And we're that's why we're keen for people to use it and we can learn more. Yeah, so in terms of the scale, when we refine things, we have to go through the validation and everything as well. So it's not quite as simple as just adding a question, but we can certainly, it's something we're very open to. We want to get that feedback. And it is designed to be used at sort of every stage of the intervention sort of life cycle. So it can be used just by a practitioner who wants to sense check if participants are feeling physically and emotionally safe in their program. So it could be used just internally like that. Whereas I know it's currently being used in a big randomized control trial in South Africa, where they're looking to actually explore if this feeling of physical and emotional safety, the relationship that has with clinical well-being outcomes and a range of other things. So the idea is the scale can be used as a tool that is both this really pragmatic tool that helps us just keep an eye on our program and look where we've got space to improve, but also can fit the role of a more quite established statistical tool that can be used in a more complicated study. In terms of the spaces the Safe Spaces course, you get a university certificate of completion. I am actually really interested in developing the course into something that could eventually be credit bearing eventually. That is, as I'm sure you can imagine, that's a lot more complicated. And it was really important for me to get the course as it is out to people. So it's not there at the moment, but it's certainly something we've got on the agenda in the future. And we'd like to think these kinds of CPDs are useful for people to have, to be able to point funders to actually, we are taking this stuff seriously. We've all done this course. Or, for example, I'm in conversations with some organizations around actually it being something they give to their lead volunteers. So their volunteers get a bit more engaged with the theory behind the intervention. And then it's also a nice way to give back to the volunteers. But so, yeah, it's kind of being used in a wide range of things like that. There is more and more momentum, as I mentioned. Having it up at the UN there was fantastic. But as that momentum continues, there's a lot more capacity for that to develop into things like proper accreditations. The Olympic Refuge Foundation have got some really interesting ideas about how we make those kinds of accreditations both as meaningful and as accessible as possible. So it's a real pleasure to be working with organizations like that to be able to achieve those goals. So yeah, the sky's the limit. This is the start. I would say I've been very focused on it being a very reflective piece. It's like, here's the theory. What does that mean to you? Because that reflective work, that's the really valuable work you do in like a university tutorial or something like that, being able to bounce those ideas and reflect around it. Now, that is impossible to do on a mass available online course, unfortunately, because universities charge a lot of time for staff. They charge a lot for staff time. So it's something I'd like to develop further. But for now, the course has that self-reflective element, which I think is really useful in terms of just where you're at, and I'd like to think everyone who does the course will come away from it thinking, I've never thought about that element of our intervention that way. So that's my aim with it, because people had those kinds of conversations with me when I was running the WAVE project, and I know the value that it added. So yeah.
Thanks, Jimmy. All right, anyone questions? All of our academic warriors out there, and Joshua, I feel like you could add a lot to Safe Spaces and talking about what you do, but yeah, I feel like Jamie, you must have covered it all, because
it's fine if not. My voice is about to go, so yeah, it's absolutely fine if not.
Well, everybody, thank you so much. Oh wait, Emily, nope, too bad, saw you.
Okay. I have one question maybe that wasn't tapped on, is the difference of safe spaces for individual therapy versus event, and what that looks like differing, and what your experience is with that.
Yeah, definitely. And the suitability for those approaches for different participants. And that's where some of the more broader, again, like I don't have a specific answer to those, but the broader concepts like feed into that. So understanding one of the key things that comes across all the different modalities is really understanding your participants. So really being grounded in expertise around what they're facing, the challenges they're facing, what might undermine safety for them. So a safe space, like examples I always use for my PhD, a safe space for US Marines on the West Coast of the United States is probably going to be quite different to a safe space for young people in East Africa. They're going to look different. But some of those broader brush things around the managing social interactions, for example. So for some people, that one-to-one approach might not only be more valuable, it might be necessary. And that's about understanding the needs of your participants. Also, there is that element, I guess, of pragmatism as well. There are times and situations where it's impossible to fund one-to-one stuff, especially within community interventions. So it's then, how do you recognize the challenges that we would ideally push towards individual therapy? How do we then make the group setting as safe as possible for them to be able to engage if that individualized therapy is not an option? And I mean, when I was doing my work in Liberia, there was one clinical psychologist in the whole country. That's it. Like, a lot of the absolute best practices we'd like to see from a clinical perspective were just not possible. But what that means is we need to get those community settings as trained up, as informed, and as effective as possible in delivering what they can deliver within those settings. So yeah, I think it really aligns with that. I certainly don't think one's better or another. I think one can be better dependent on the need of your participants, but also at the same time, we need to recognize the realities of delivering it. I have quite a bias because a lot of the work I do is in like sort of post-conflict situations where there's often limited resources and limited availability for that kind of thing. So I would be interested to dive into the one-to-one components of safe spaces more. There is some really interesting work in sort of nursing research, especially when I was first exploring safe spaces, there was so little research in the sport development world that I had to go look at all the other paradigms. And there is some really interesting stuff around power balances and things like that within nursing research, which I think is very translatable. And I think the more we can sort of draw on those cross-paradigm learnings, the better. So yeah, I encourage you to look at the paper, and actually it'd be really interesting to reflect through the different characteristics and coach behaviors, but reflect on them from a group approach and a personal approach. I think that'd be a fascinating exercise to do. I'd be really interested to hear how you found that. So I'm not saying your homework, I have to be very clear on that, but yeah, that would be fascinating.
Well, Emily, she is being humble. She's getting ready to do her capstone in OT, occupational therapy. Many of us talk about surf therapy, ocean therapy coming from OT. So Emily, great question. We've got two more hands up. So Luce, you put your hand up first. Go for it.
So I have a quick question. First off, thank you so much. This was great. I have a question about using the spaces scale. So we deliver surf therapy for seasonal. So we do 6 months and then 6 months on, 6 months off. So if we were to collect this for a whole season, is this something that you would recommend we do this every year? And like, how do we present that data finding at the end of the year? Because my guess is as needs for women veterans change, as the US administration changes, needs definitely change, things get cut. So my guess is that what the scale would reveal in 1 year might be very different for the next year. So I'm just wondering like how often to do the scale and then also like how do we present the findings from that?
I'm going to be such a classic researcher and sort of not sit on the fence, but give you an answer. I mean, one of the main things, well, firstly, again, that just sparks, I know we've had these conversations before, Luz, but it would be interesting and potentially quite scary to deliver a version of this scale within VAs. I think it might open some eyes to actually how people feel in some of those institutions, despite fantastic work that lots of individuals do in those institutions. There are some structural challenges around a lot of VAs that a scale like this could help us illuminate and hopefully fix. In terms of the regularity of using the scale, it kind of depends what you want to track. It could either be used as a sort of drop-in snapshot once or twice a year, just to check that your participants are feeling physically and emotionally safe within the program. The other option is you could do a more systematic thing where you are collecting it 3 or 4 times a year, but starting very much at the start of their journey and see how that experience of safety changes. And that's very much what that study, for example, I talked about South Africa. they anticipate participants will start to feel safer, and then that will start to predict some of the well-being changes. There'll almost be a longitudinal, it's almost like the dominoes going down, and that's the sort of relationship they want to explore. So it kind of depends what you'd want to do. I do think for a program, being able to demonstrate that your participants after a certain period of time feel physically and emotionally safe, and there's items in there that are specific around being able to comfortable to share these sorts of things. I think those metrics in themselves are really useful to be able to say to funders, to actually say, you know what, after 3 months of engaging with us, participants are scoring really highly on this, and this particular item about being able to share openly or whatever it may, or able to be myself. You know, those single items, and we talk about this on the thing, that there are single items you can pull out to, you know, you can't make grand statistical claims off a single item, but actually if, you know, 90% of your participants are saying they strongly agree with it, they are able to feel them, they're able to be themselves at your program. That's a really cool metric to be able to share, and with funders, with policymakers, with whoever it may be, with the participants themselves, reflecting that back to the participants can be very powerful. Like we're really grateful that you do feel you're able to do that, and you know, really being able to reflect on why they feel able to do that and maybe not in other places. So we have designed the scale to be used as flexibly as possible. It's not a diagnostic criteria that has to be used a certain way. And yeah, I'd really encourage you to, like I said, I'm going to send it to Chris right after this, because I should have thought about that beforehand. But like download it, read all the different ways we've presented of using it, because we go through different ways you can use it. If you do the CPD as well, there's actually there's a whole lecture on the scale from Russell, and he talks through the different ways of doing it. But yeah, download it, have a play with that, and then yeah, I'm happy to answer further questions on it. But yeah, we have tried to design it to be as flexible as possible, not something to be used a very specific way. So really, once you've got your teeth into the scale, we want to hear what it can do for you and your organization.
Yeah, Luz, I love that you asked that question. Let's get that done. Let's see. I want to see where you go with that study. All right, Lena, thanks for coming on here. I also love that the questions are enticing more people to ask questions. So yay. One more question, Jamie, after Lena. Go ahead.
Hi, and thank you so much for the presentation. I wrote, by the way, a question in the chat, but it doesn't seem to work. I don't know if it's my end or if other participants have had the issue. So you mentioned the importance of surf coaches themselves being supported like supervisors for therapists, which makes a lot of sense. And I wonder if you have any research or resources to recommend to learn more about what programs have done in that respect.
It's not something I've done any specific research on. I'd encourage you to potentially reach out to organizations. ISTO is a great way. It sounds like you're surfing based. ISTO is a great resource for reaching out to people, and there's a number of organizations who do this really well. Ways for Change I referenced in the study do it really well, and I mean exceptionally well, given they're in a you know, the sort of mental health resources are not, you know, they're not bountiful in South Africa, shall we say. You know, there is a lot of pressure on mental health resources in South Africa, and the fact they still have found a way to make sure their coaches are supported is really good. Waves of Wellness in Australia, you know, their coaches, a lot of their coaches are clinicians, but they still make sure their clinicians have additional clinical support. So I'd encourage just maybe doing some digging around organizations, potentially, ideally ones that are near you, who you can reach out to learn a bit more about that. There is research out there around how to around supporting people in more sort of clinical spaces, if that makes sense. And it's actually emergency services as well. There's some interesting research around how you support emergency service workers. I know from my own work with the RNLI, we've got a whole range of resources that are available to us after a difficult shout. So there is a lot of stuff out there. It's not something I've gone into a lot of detail, I'm afraid. I can't point you to a specific paper or something, but I would encourage you to reach out to organizations who might be able to give you a bit more insight. Certainly Waves for Change or Waves of Wellness are probably two good starts. They'll be very grateful for me adding to their workload, but yeah, no, I'm sure they'd be absolutely delighted to let you know how they do things and maybe point you into the direction of it. It would be a cool idea to actually build out I know ISTO in the future is going to have more of a best practice library, and it actually, I will try and look into make sure we we do have stuff in there already about supporting your staff, but actually maybe trying to get some more intentional stuff around that I think is a really good idea. So I'll look into that as well.
Thanks
Yeah.
so much.
Lena, such a great question. There are other programs. Surf Project is really great about that. And actually Wave Project, I feel like they're working on all of that staff. I mean, and Joshua travels a lot with his staff. I imagine you have to work on that. Okay, Tatiana, thanks
I would
for
just say, sorry, I'd just say actually the one thing I would say on top of that is like support communities of people who get it is really important. So actually ISTO at times has been a safe space for me where people have been able to support me when I've been through difficult things, because basically most people involved in surf therapy or physical activity, mental health interventions, they go through these challenges, whether it's like the funder suddenly pulled the plug or they've had a really difficult participant. So actually, alongside formal structured clinical support and things, having a peer support network of people who like get it, people who speak that language is so, so valuable. I know it's something that we really try and promote in blue light spaces where you have somebody who's maybe been through similar stuff and you can just have a chat with them. We have a whole setup in the RNLI where basically if I go through something difficult and I feel like I'm not dealing with it very well, I can reach out to a crew member who's got a bit of training but is on a different station. So I'm not having to necessarily share with the guys I'm on the boat with all the time, but I'm sharing with someone who gets it because they're active crew. So actually finding and creating those peer support networks is really valuable. And in the surf therapy world, ISTO does that really well and has done that for me at times. And I know it's come up at ISTO conferences several times that it does that for people. So those kind of informal peer support networks, sorry, just as Chris was talking, that one sparked for me, hugely, hugely valuable. And building those for your coaches and potentially for other people in similar circumstances is a really, really valuable thing to do.
Yeah, and this year, real quick, Tatiana, sorry, before we get to you, our conference is online October 1st and 2nd, but we will have, Lena, it's probably a great space for you to go in since it is online. We'll have breakout rooms where people can go and like have a hot topic and people want to talk about it and join that room. There's a lot of the collaboration and connectivity that happens obviously in person. So we're going to do everything we can to make that happen online. And then we'll go back to being in person starting next year. All right, Tatiana, go ahead. Thanks for joining. Oh, you're on mute. Sorry, Tatiana. It's okay.
Thank you. Thank you. Thank you so much. Really inspiring. And it's my first time I'm on such a webinar in International Surf Therapy Organization. And continuing from, I'm sorry, I'm a bit nervous and English is not my native language. That's why I'm like, I can lose some of the words. Thank you. Continuing the question about seasons. For example, well, I'm from Russia, and in our country, we surf mostly. It's more possible to surf in summer, especially if talking about Baltic Sea and maybe Kamchatka. So I mean, is there any, I don't know, options or about this, how to say it, this safety spaces in between these surfing seasons? Because during winter, there is no place to surf. Only super brave surfers can surf in icy water, but not people with some special needs or kids.
Yeah, that's a fantastic question, and yeah, you definitely brought it to the right space. As someone who set up surf therapy in Scotland, I have done surf therapy with snow on the beach, but yeah, we had a big winter break because at certain points of the year it was just too cold, like from a safety threshold. Yes, the experienced surfers were sometimes still going out, but for the young people, the beginners, and even just, especially when you're working with young people, a lot of them are quite small. And smaller people get colder quicker, so we did have this this break that we had to manage. And actually, quite early in my career, I recognized that was a problem because you want that continuity. If you actually remember back to the safe space characteristics we talked, one of them is consistency. It's about being able that consistency, being able to offer that within what you're doing. But that doesn't mean you have to be doing the exact same thing. So we did all kinds of things through the winter, and we got quite creative. And actually, again, this is before my research career or anything like that, but it aligns so well with what I've talked about today, in that we got creative. So we did things like yoga, because yoga aligns with surfing. Like during lockdown, when we had the COVID pandemic in the UK, I did yoga every day, and I can tell you, when I was allowed to surf again, I surfed better than I'd ever surfed before. I now don't do any yoga, and I surf terribly again. So yeah, there's a clear connection between surfing and yoga, but it was something we could do inside, but we could still be together. It was something we could do, and we could apply all of those safe space elements. We were learning it together. We were having fun. It was social. We could go at our own pace. We had some fantastic instructors come in who really just were like really patient at helping people go at their own pace. I remember we did one really fun session that was the participants and their parents or carers. So they did it together, and they were saying how fun it was to do something that they got to do together. Now, like that wasn't a genius idea I had. One of my volunteers was a yoga instructor. So they said, I actually started saying, well, I'd like us to be able to put something on for the young people during the winter. And I had like a group with my volunteers, and I said, has anyone got any ideas? And yeah, we did. So yoga was the first one that came from a volunteer. The craziest one I think I did was like a free diving and spearfishing one, which was absolutely amazing, because we taught the young people about breath work, which was really, really great. But we tied it to this idea of spearfishing, and then we had this whole thing with, do you know the little Nerf guns with the foam darts? They like practiced shooting a cardboard fish with a Nerf gun while holding their breath. So it kind of became this play thing. But again, it was something we could do together. It was something people could do at their own pace. That one was really cool because we got the breath work in. Obviously, breath work's such a useful thing for emotional regulation. I know the Wave Project these days, they have a bit of surf skating, so like the skateboarding style of things. So yeah, that's where I think it's really important to remember that the surfing isn't the silver bullet. The surfing isn't the thing that's doing all the good. It can help. It's fun. Physical activity is good for your mental health, but it's a vehicle for which you deliver this fantastic community safe space. I'd love to hear more. I've not heard much about surf therapy in Russia, so I'd love to hear more sometime. But the surfing is the vehicle by which you're delivering these safe spaces. And if you change that vehicle, the safe space is still there. So if through the winter you're doing semi-regular yoga, people are coming together, they're getting the peer mentoring, they're getting the relationships, and the vehicle's still the same. And actually, I'm a great advocate for multi-modality programs, because the simple fact is surfing's not for everyone. Some people just don't gel with surfing, and that's absolutely fine. Some people don't gel with yoga, and that's fine too. So actually, when we have a bit of variation within our program, it can be quite useful for helping people find what works for them. Because some of the key messages we want to get is we're trying to help people who, from the sort of sport for development in a mental health context, one of the best outcomes we can have is we help educate people. We not only help them feel better, but we educate them about how they can arrive at feeling better. So I've got a study that's under review at the moment where we were looking at long-term impact in the WAVE project. So we were looking at people sort of 10, 15 years on from their first ever engagement with surf therapy. And what we found was really powerful is young people who are now young adults working, doing all kinds of things. They talked about how the WAVE project taught them it was okay to be themselves. It taught them how to access social support better. It taught them how to intentionally look after their mental health. So I remember one of the great examples in that was a young girl. She said, the surfing always made me feel much better. And I recognized that was because I was outside and I was active. And even later in life when I couldn't surf because I had to move away from the coast, I made sure I was out walking regularly and doing these things that I knew were good for my mental health, and I was prioritizing them. So those wider elements are not necessarily tied to surfing. So I would get really creative. I would get with your team. I'll get with your team up in Russia and brainstorm out what could we do? Like, what do we have access to? What expertise? What volunteers? What are there any local businesses who might help out, like a local yoga? I don't know. Anything like that. Is there a guy down the road who everyone thinks he's a bit mad because he skateboards? You know, like get him down to talk about skateboarding. Really map what's possible for you. And yeah, it's basically there is no wrong answer in my opinion, because I'm sure you're already this calls, as I said, is quite an interesting one, because I think most of you were probably very good at these safe spaces before. If I can give you one angle that you maybe haven't thought about before that helps it be even better, that's the aim. But taking those safe spaces and applying it to different contexts, I'm sure you'll knock it out of the park. So yeah, really, there is no wrong answer. Have a play. And the other thing is try things out, and if they don't work, that's fine. Try something else. Like that's how I've learned everything in my career, whether it's practice, research. Yeah, equine therapy is very big. Funny story, I'm almost phobic of horses. And when we had the surf therapy in Scotland, a few of my participants, they used to do the equine therapy as well. So they knew, and the horses used to come on the beach. So they knew the people at the stables. And the kids found out that I was almost phobic of horses. So the next time the horses were down the beach, they got the people to bring them right down to the water. And I just disappeared slowly out to sea. I'm not even conscious when I was doing it, but I was like in shoulder depth water by the time the horses got to the edge. My wife, who's stayed on the call, could tell you countless funny stories about when I've noticed there's horses nearby. But yeah, they are brilliant. They the evidence behind equine therapy is very strong. So yeah, and again, but I think, you know, the guys and girls doing that equine therapy, there's some really interesting research around non-verbal communication with horses, especially with ASD. But fundamentally, all of that stuff wouldn't happen if the people delivering the equine therapy weren't delivering those safe spaces effectively. If that stable, or is that the right word? Yes, that place, that stable ranch, I don't know what the word is, but if that place is not a physical and emotional safe space, none of the other stuff will work. So yeah, as long as you're delivering that safe space well, whatever activity you end up going for, Tatiana, it will have a positive effect for the people you're working with. But yeah, great question.
Yeah, and Tatiana, I would also, other programs, they literally will say, everybody bring like a lunch and let's just sit by the sea. Even obviously, if it's cold and what have you, you got to have jackets on, you got to have whatever. But to Jamie's point, taking walks, or everybody bring a coffee or tea, whatever, something hot, maybe. It's just, we know that being in and around, near, on, or underwater makes us happier and healthier and more connected. Blue Mind by Wallace J. Nichols. So if that's the case, quite literally anything you did near the sea, even if it was just walking and talking or sitting, can work. And other programs have done that. There's a veterans program where when they cannot surf, do a cool movie night, like a surfing movie night. I mean, we want to stay in line with surfing, but it doesn't need to be a surfing documentary, but you know, it's all of those things that you can think of. And Emily, yeah, Surf and Turf does that. When they're not in the ocean, they're on horses. So the equine therapy is a lot of, like Jamie just said, a lot of research around that. And it has been. I mean, we know that that's universally accepted through universities, because you can get an accreditation to be an equine therapist. So, all right. Well,
sorry,
we are 32 minutes over.
You've reminded me one quick thing as well. Actually, art and things like that can be brilliant as well. So
Yeah,
like creative things, like, you know, we did a really cool session where we had a local art teacher come in and we made these amazing waves together. You know, so really get creative with it. It's a funny story because this is my little office. But when surfing sometimes isn't a relaxing thing for me, because I work so close to surfing that sometimes that joy is not there for me. So one of the things I do, I'm just going to embarrass myself on camera here, but like I actually like to relax. I like paint little models. So like here's my little lifeboat that I made up and painted, you know, like, so finding like building and painting a model lifeboat, that could be a surf therapy session with some kids, because you do it together. You know, you create that space, we check in with how we're feeling, and we work on a little project like that together. So I really just want to stress, like, there is no wrong answer, as long as we're being intentional around those safe spaces and how we are with the participants we're working with. So yeah, there you go. There's my. I like to bring up my model. It's starting to get less embarrassing for me now. I keep bringing it up as my little embarrassing thing, but like it's not embarrassing at all. And that's what I'm trying to say is there's no right or wrong. That's how I look after my mental health these days. When I can't go diving or something. So yeah, it really, Tatiana, anything like get together with your team and brainstorm, and there is no wrong answer.
Yeah. All right, everybody, thank you so much for being here. You'll receive emails soon with all of these links. I highly recommend the CPD course. And yeah, if you're using the Safe Spaces scale, please keep us posted on all of that. ISTO conference, October 1st and 2nd. Hope everybody can join, register online. Thanks, everybody, for coming. Thank you, Jamie Marshall, Dr. Jamie Marshall, Dr. Surf. Thank you very much. Have a great day, everyone, or night, Tatiana.